8:13, hot and humid today, but wait, it's going to get even hotter next week, they're saying, and maybe a little bit drier. Got some rain yesterday in Belle Chase to water the ground, and it just sucked it right up like a sponge. Hurricane season, as we all know, kicked off last week, lasts through November. So if you have not yet begun preparing your hurricane kit, now's the time to do so. And what we're about to talk about here applies to everybody, not just seniors. Dr. B joins us from People's Health to discuss hurricane preparation, including ways to protect your health during hurricane season. And with that, we welcome in Dr. Brent Wallis, Chief Medical Officer of People's Health. How you doing, Dr. B?
Hey, Tommy, I'm doing great. How about you?
I am okay. As long as the tropics are quiet, I'm good. I'll take the heat and the humidity. Just numb on all that other stuff, right? I guess we should start with, what is a hurricane kit?
Sure. Yeah, so a hurricane kit really is the cornerstone of your overall emergency plan, and that's the plan that kind of tells you what you're going to do if a storm is heading our way. And the kit is really a collection of basic items that you may need in an emergency, whether you decide to shelter in place or if you're going to evacuate either before or after a storm. And, the items can be packed kind of conveniently. You really want them in an easy-to-carry container, maybe a duffel bag or a tote. But it's really a well-stocked kit that lets you evacuate quickly and keep you safe during and after a hurricane. And I tell people to store their kit in a safe place, somewhere where you can find it. Be sure that your family knows where it is as well, and then update that kit regularly. So if family needs change or your medical needs change, you want to make sure you check in there for any expired items. And keep in mind, we didn't have a storm, a major storm last year here in Louisiana, so sometimes people can forget everything they need to do to be prepared.
It is important, though, to have a container, as silly as that may seem to some people, rather than just, well, I know what I need. Get it all together in one place, because now you're thinking clearly, as opposed to, God forbid, you got a Category 5 bearing down and you're going to forget this or forget that, right?
Yeah, absolutely. You're running around trying to board up the house and get everything inside, and this is the last thing you want to be thinking about, so have it ready to go.
Get one of these containers or a duffel bag or whatever, one of these, the plastic storage things. What are some of the must-have items you should have in that hurricane kit?
Yeah, so everybody's kit's going to look a little different based on what you need, but a couple of essentials you really need to have in there. A first aid kit. Most injuries happen after a storm, so you want to have something to treat those if needed. You want to have water and easy-to-prepare foods, non-perishable foods, so things that are packaged or in cans. You definitely want to have a flashlight. We know our power goes out pretty frequently. Radio, is very important, so you can listen to WWL and get that information.
Right.
Yeah, and then batteries. That's another thing. Don't forget, because you're probably not going to have power, so things are going to run on battery. So make sure you've got backups. And then, you really need to make copies of important paperwork, so things like your license, a valid ID, your insurance card, maybe your birth certificate, and even insurance information. Make copies of those and put them in there. And if you've got pets, make sure that you pack a bag for your pets, too. They need food, maybe medications, and any sort of supplies that they may need.
How do you determine or figure out how much food and water?
Yeah, the American Red Cross says, you really need to sustain yourself for about 3 days. That's a good guide so that you can get assistance somewhere else. So what that means is you need to have a gallon of water per person per day. That's sort of the minimum amount of water that you need to drink, especially when it's super hot after the power goes out. Food, you can go a little bit longer without a ton of food, so just make sure that you've got enough in there to keep you sustained for about 3 days, and that can be really important after a storm or if you need to go to a shelter.
And if it's a canned goods, make sure you got a can opener, otherwise you're not going to be able to get into that. What are some other items, Doctor, that people may not think of to include in their kit? And then again, that goes to the idea behind doing it ahead of time, right?
Yeah, absolutely. Contact information for your family, any loved ones is really important to have. Your health plan information, kind of local medical facilities where you may go. Write that information down. So you may have trouble using your phone if the cell towers are down, or your phone may be out of charge. So, bringing a little battery pack for your phone can be important as well to try to keep that up and running. For people that have trouble with either their speech or their hearing, I usually tell them to pack a pad and pencil too. It's going to be loud and crazy, if a storm has occurred and everything, and you may need to write things down or communicate via writing as well. And then the other thing is, if you are kind of hunkered down in your home with no power, make sure you have something fun to do, a book or a puzzle, maybe some playing cards, because it can get a little crazy after a storm.
What about health-related items?
Yeah, excuse me. One of the most important things is, when a storm occurs, you have to keep taking your prescribed medications, even during that emergency period, and sometimes even more so during that emergency period. So you want to make sure that you've got all of your prescription medications. If you do need to leave your home, you want to make sure you put them in the original containers, or at least bring the original containers along with you, because a lot of people use pill boxes, which is great, but you've got a little round pill and a little square pill, and it's going to be hard to figure out what those are. So the containers are very important. I always say ask your doctor to print out a list of your medications with the names and the dosage and how you're supposed to take them as well. You can throw that in your bag. And then don't forget to bring things like eyeglasses and hearing aids and your dentures, or any medical supplies you might need. It may be difficult to replace those items, especially, in the first couple of days after a storm. So make sure you've got all of those available to you.
You won't be ready, but you can't pack everything away for the entire hurricane season, right? So how do you maybe keep some things on top of your mind so you know where they are when it is time to go, if you have to go?
Yeah, definitely. Your medicines in particular, you're not going to throw those in a bag and let them sit there for a couple of months. So you want to have that kit kind of ready as best you can. But you're right. There's some items you're not going to be able to pack until you absolutely need them. So what you can do is just make a list of those items. It's kind of like a placeholder in the note. Put where you typically keep them and what you need to do. It's a little checklist that you can throw in that duffel, so that when you are ready and you do need it, you can pull it out and you can quickly go down the list and say, okay, these are all the things that I need. And, during all the chaos, you're not going to forget anything.
All right, let me take a break. We'll come back. We'll pick it up here talking about people with chronic conditions and preparation for hurricane season, especially with diabetes and hurricanes, how they can, the stress from those affect chronic conditions. We're talking with Dr. Brent Wallis, Dr. B, Chief Medical Officer of People's Health. We are in hurricane season, so we're talking about hurricane preparation kits and how to be ready. We'll continue when we come back. Right now, traffic, WWL. 825, Tommy Tucker, WWL. Quickly back to Dr. Brent Wallis, Dr. B, Chief Medical Officer of People's Health, talking about hurricane season and getting your hurricane kit ready to go. Doc, for people with chronic conditions, I guess there's even more preparation to consider, huh?
Yeah, absolutely. If you've got a chronic health condition, it's really vital that, like I was saying, that you continue to take care of yourself and take your medications in particular. And that may require a little extra planning on the front end. So for example, we've got some patients that are on dialysis. They have kidney disease and they have to go to a dialysis center. So, you may not be able to do that in the area that is affected. And so you want to make sure you've got a printed copy of the doctor's orders, and you want to know where you're going to be evacuating to so that you know where you can access the care that you're going to need. Have the phone numbers and addresses of dialysis centers, so that you can get in where you need to. And if you do need to evacuate, you want to bring all that information with you and ask your health plan if there are limits where you can receive care as well. Usually you can go almost anywhere, but it's important to know what the rules are.
How about people with diabetes?
Yeah, even in an emergency, diabetes is tough to manage anyway, but you need to make sure you're trying to at least eat some nutritious food and make sure you're checking your blood sugar, at least once a day. It's really essential to bring a glucagon emergency kit. That's actually a kit that raises your blood sugar if it goes too low. And then, like I said, a blood glucose meter, and make sure you have your supplies, the Lancets and the test strips, so you can check your sugars at least once a day, especially if you're not feeling well. You want to make sure you've got at least a 2-week supply of your insulin, including all those supplies like the needles and the syringes. And then low blood sugar can happen, especially if you're not eating like usual. So make sure you've got either glucose tabs or some juice, maybe a regular Coke soda or something, just so you can bump your sugars up. You don't want them to go too low, and you don't want them to go too high. And then make sure for diabetics that you're wearing protective clothing and shoes at all times. Like I've mentioned, a lot of injury can occur after a storm, and with a diabetic getting an injury, a skin breakage or something like that can lead to infection.
That's a great point. Hurricanes, of course, mean more stress, and I guess that can affect chronic conditions as well.
Yeah, definitely. It's really important to keep that in mind. Stress causes your body to release cortisol. So if you have something like diabetes or high blood pressure, the cortisol, which is a stress hormone, can cause your blood sugar or your blood pressure to rise. So if you start feeling bad, you start feeling overwhelmed, you really want to stop, rest, take it easy, because you want to reduce that level of stress hormone.
Sometimes prescription refills can be problematic in and of themselves. It can be more so during hurricanes. What if you need a prescription drug refill during a hurricane?
Yeah, so, like I said, you want to try to have at least 2 weeks of medication on hand, and so you want to work with your doctor, especially if you know there's a storm coming, to make sure you get those refills. And sometimes if it's too early for that refill, you may need to call your health plan and actually ask them about an exception. During an emergency, when there's actually a storm in the Gulf, the health plans will usually waive coverage requirements, and they'll allow you to get those prescriptions earlier so that you've got them available. It's another reason why you want to make sure you've got your health plan in your emergency kit for when you evacuate. That way you've got the phone number on there. You can call them for anything you may need.
Before we wrap it up, some emergency resources for hurricane season?
Yeah, there's a lot of resources on the web and via phone. Weather.gov has a lot of information about any alerts that are coming. 211 is a real easy thing to remember. You can call that about any basic needs, either before or during a hurricane. And then the state has a great website at www.emergency.louisiana.gov. That's got information about any storms that may be coming up, and then also recovery, so all the stuff we have to deal with after the fact.
I hope a year from today we're doing the same thing and talking about how it's been 2 years since we've had a hurricane. Thank you, Dr. B. I appreciate your time.
Thanks, Tommy. You have a great weekend.
Dr. Brent Wallis, Chief Medical Officer of People's Health. To find out more about People's Health, you can always go to peopleshealth.com. You can visit the People's Health Medicare Center at 3017 Vets in Metairie, next to Party City. Appointments are recommended. Walk-ins are welcome. You can call 800-978-9765. And you can always follow People's Health on Facebook, Twitter, and Instagram. A quick break. When we come back, we'll talk to Jim Donelon, Louisiana Insurance Commissioner, see how the session has been going and has anything been done to help homeowners with their insurance troubles. Tommy Tucker back in a flash, WWL.